Good evening, class. This is Tricia Fioravanti, and I am here to present a discussion on evidence-based nursing practice and the nurse leader's role. At the end of my presentation, the learner will be able to define evidence-based nursing practice, discuss the benefits and barriers associated with it, and identify ways the nurse leader can promote evidence-based nursing practice. In order to have a discussion, we must first understand what evidence-based practice is. While there are many definitions, evidence-based practice is a conscientious, problem-solving approach to clinical practice that incorporates the best evidence from well-designed research studies, patient values and preferences, and a clinician's expertise in making decisions about a patient's care. It is a continuous, interactive process aimed at improving quality and outcomes, as well as decreasing the costs of healthcare. The article Setting the Climate for Evidence-Based Nursing Practice, What is the Leader's Role? By Udad and Kerr discusses the obligation of nurse leaders to cultivate a culture of evidence-based nursing practice that leads to quality care and increased satisfaction for nurses. The paper draws from a previously conducted study to address the challenges facing nurse leaders relevant to research-based practice. It also discusses the benefits and barriers in the nurse leader's role to promoting and implementing evidence-based practice into the workplace. The common managerial competencies were used to assess nurse leader performance across identified skill sets. These skill sets include technical, human, conceptual, leadership, and financial. The findings were surprising in that both competencies for research-based care practices and research process ranked low among surveyed participants in the need to know and ability to implement categories, indicating that nurse managers felt these were not areas in which they performed best. These results raised concern regarding the ability of nurse managers to implement and promote evidence-based nursing practice. The inability of leaders to identify the importance of evidence-based nursing practice will have a direct impact on staff nurses' ability and desire to incorporate research into care. It also acknowledges the responsibility of the nurse leader towards promoting a culture of evidence-based practice. We cannot expect different results if we are doing the same thing over and over again. Both benefits and barriers to evidence-based nursing practice need to be understood to produce a change in thinking that results in the successful adoption of it into the workplace. The benefits include that it adds to the scientific foundation of nursing, increasing our credibility as a science and profession, moving nursing practice forward. The inclusion of evidence-based nursing practice also adds to the credibility of the profession and enhances our professional status. We are seen as knowledgeable. Lastly, it improves the quality of care we provide along with patient satisfaction. It offers a platform for client participation in a time when clients seek to be more involved with their healthcare decisions. Barriers fall into three main categories: the individual, the organization, and the environment. The competence of the nurse manager is a critical element to evidence-based practice. The challenge of implementing EBP is related to their lack of academic skills and apprehension with the overall process. Many nurse managers fall into the old school mentality where care is based on standards, procedures, and protocols. Nurse leaders are also tasked with more managerial responsibilities, removing them from daily patient care activities and creating a gap in the need for evidence-based practice. Nurses currently work in a complex environment that leaves them little time for more than patient care during their shift. Their lack of limited skills and time produce a research practice gap. Staff may also not fully understand or value the idea of evidence-based nursing practice and how it can impact care and create work-related efficiencies. Finally, heavy workloads and decreased staff leave less time for nurses to participate in the evidence-based research process during their regular day. Organizational barriers to evidence-based nursing practice include difficulties in accessing evidence, resource constraints, skill development, and management priorities. The organization may have limited access to library resources, as well as a lack of knowledge regarding how to efficiently navigate complex databases. In addition, licenses to databases are also costly. Resource constraints. Here again, we revisit workloads of nursing staff, leaving them limited time to participate in and attend research-related activities. Skill development. Organizational budget constraints leave little opportunity for the skill development necessary to create a workforce empowered towards evidence-based practice. Management has not created a sense of urgency across the organization, setting the standard of care to be rooted in the evidence. Recruitment and retention impinge on the agenda to incorporate evidence-based practice and make it an everyday reality. Environmental barriers are grouped into social influences, culture of change, and a shift to managerial responsibilities. The impact of healthcare reform requires us to be cognizant that nursing is but one player in the journey towards evidence-based care. We must continue to be influential in shaping the direction of healthcare. We must create a positive culture of change by overcoming workplace unpredictability. As mentioned earlier, the nurse manager is being moved away from providing clinical expertise to focusing more on administrative tasks. While the business of healthcare is important, nurse managers should be allowed time to devote to implementing the best clinical practices that research provides. A multifaceted approach is required to promote evidence-based practice. All domains posing significant barriers require strategies to overcome these barriers. Nurse leaders must demonstrate commitment through role modeling and becoming champions of care. They should be able to search and appraise evidence and use it to make decisions, creating networking opportunities. Nurses should share evidence in a collaborative manner, as well as seek the expertise of coworkers in determining best practices. Staff should also rely on each other's strengths to make efficient use of time, skills, and resources when initiating the evidence-based research process. The concept of shared leadership promotes a team-based environment where responsibility for leadership is shared between leaders and staff alike. Staff nurses should be active participants in decisions affecting their practice. Finally, nurses need support from their leaders in both word and action to develop evidence-based nursing practice competencies that will decrease the existing research practice gap. This will be difficult to accomplish without such support. The organization plays a big part when it comes to promoting evidence-based nursing practice. First and foremost, the goals of the organization should be linked to evidence-based nursing practice. This can be done by incorporating into job descriptions, performance reviews, yearly competency training, and quality improvement projects. Understanding the organization's history related to change is also an essential part in developing and sustaining a culture of evidence-based nursing practice. Leaders should identify early adopters who can assist with decreasing the resistance to change. An evaluative component to demonstrate positive, appropriate, effective, and efficient changes is needed to monitor the impact of evidence-based nursing practice on patient and staff outcomes. Access to resources through an information-friendly environment that provides linkages to data helps facilitate the research process. Comprehensive training programs are necessary to educate nurses on the evidence-based research process and how to sustain change. Finally, nurses should be rewarded and recognized for taking an active role in solving clinical problems. This will motivate others to do the same. As far as the environment is concerned, human resources. The staff nurse is a necessary commodity to making a difference in patient outcomes and cost efficiencies. Without them, evidence-based nursing practice would not become a reality. It is essential that the nurse leader build positive and collaborative relationships with their staff, as they will be the primary users of evidence-based nursing practice. Nurses should be encouraged to continuously ask questions related to their practice and determine if there is enough evidence to support their current clinical activities. Nurse leaders need to promote this shift in order to establish a culture supportive of evidence-based nursing practice. Finally, the organization must focus on creating a learning environment supportive of evidence-based nursing care. Nurse leaders need to provide and encourage staff attendance at conferences, educational sessions, or any other opportunities that allow for knowledge building. My experiences with current leadership are consistent with the study's findings. Staff in the ambulatory care management department are currently disengaged and resistant to change based on lack of supportive leadership. Most likely it is because these leaders are unfamiliar with the evidence-based nursing research process. Overall, our Rochester Regional Health does a good job of attempting to incorporate evidence-based nursing practice into the organization. It is included in our job descriptions, yearly competency, and performance evaluations. We even have a department dedicated to evidence-based practice that can be accessed through our organization's intranet site. In addition, we are very fortunate to have a library equipped with expert librarians who will take the time to educate staff on how to conduct searches through the professional databases, or who will conduct the search directly for you. Our recent magnet status designation also indicates that we are an organization dedicated to evidence-based practice. However, there is always room for improvement. Much of the evidence-based nursing practice rewards and recognitions are directed towards inpatient staff. Outpatient nursing also needs to be involved and recognized as part of this process. The origins of evidence-based nursing practice can be traced back to the founder of our profession, Florence Nightingale. Although she was not aware of it at the time, she applied the concepts of evidence-based practice using medical statistics to reveal the nature of hospital-acquired infections and improve care. Tracing the origin of evidence-based practice back to Nightingale is an indicator of the need to continue the process of improving the quality and effectiveness of patient care today. As master's prepared nurses, we are challenged with continuing to further the movement towards establishing evidence-based practice in nursing. We can achieve a culture of evidence-based nursing practice by creating a collaborative atmosphere and shared responsibility among all the key players involved: the organization, the environment, and the individuals, both nurses and nurse leaders alike. Thank you.